Hello everyone. Am I audible and visible to you? Okay. So myself, Dr. Sheetal Pipalia, welcome on the platform of Unacademy. I did MD Physiology from MP Shah Medical College and I'm educating MBBS and MD students. I have teaching experience of more than 17 years and I am one of the experienced faculty for integrated curriculum teaching. Let us go through some subscription details of Unacademy. With the Plus subscription, you can have access to both live as well as recorded classes. You can learn from the topmost educators of India. You can compete in live tests and quizzes. You can study on the device of your own choice. You can have access to the question bank having more than 25,000 questions in it. You can even have a printed notes available with certain subscriptions. Now, let us go through Iconic subscription. With Iconic subscription, you can have access to both best from the two of the best. Unacademy and Prep Ladder. With Unacademy, you will find well structured live batches, recorded classes, competitive live tests, and quizzes, and many more. Unacademy and Prep Ladder. With the Prep Ladder, you will find clinical and integrated essentials, video lectures from Dream Team, rapid revision and snapshot, and many more. So, both are unique in its own way. Whatever is best suitable for you, that you can choose. Now, Unacademy came up with some special class feature. Now, what is this? Now the classes will be highly interactive. There will be also a poll for the learner. You can raise a hand and interact with your educator. You will never miss a class because Unacademy will send you regular notifications. Lecture notes are available and you can have access to the recorded sessions also. You can attend the classes from any time, anywhere. As I told you, there is a highly effective question bank, updated highly effective question bank. More than 25,000 high-yield clinical questions are there, which are based on latest exam pattern and it includes detailed explanation. These all are toppers of NEET PG September 2021. Congratulations to all the toppers from Unacademy. As I told you, there is a raise a hand feature. So now the classes will be highly interactive. You will be engaged with the quizzes, Viva, doubt solving, and many more. Unacademy Medical PG Taste is there. Free test to choose. With this, you will find educator curated taste series, FMG, Grand Taste series, Study with Me, YouTube Taste series, and many more. With Plus Batch Test Rituals, you will find NEET PG 2022 subject-wise test series, NEET PG 2022 Grand Test series, and many more. So there are two batches, Focus FMG 2022 comprehensive batch, duration is 6 months, already started from 15th of December. Target NEET PG 2022 taste and discussion batch, duration is 3 months, already started from 15th of December. So NEET PG subscription, Iconic subscription and Plus subscriptions are available with various duration and different prices. You can use the code Sheetal10 to get additional discount. As I told you, there is a free test on Unacademy. Educator curated test series is there. Scholarships are available with different ranks. So you can check it with this. Different time and date and check with the subjects. Use the code Sheetal10 to unlock the free test. 872878 is a code to attend the quiz on app. Now, Unacademy came up with the mock test, All India mock test, so you can taste your journey with this. Use the code NPG10, okay, to enroll for the now. February 19, 9 a.m. is a time. Use the code NPG10. Now come to today's topic, that is white blood cells. See, the word itself says, right? Other name is leukocytes. Leuko stands for white and cyte stands for cells, right? So leukocyte means white blood cells. There are different types of the leukocytes. Different types of the leukocytes, that is granulocyte, agranulocyte. Granulocytes are neutrophils, eosinophils, and basophils, and agranulocytes are monocytes and lymphocytes. See, the word itself says granulocyte means the one inside which the granules are present, right? Or you can say granules are seen in the under the microscopic examination. You can see the granules, right? So that's why they are called as granulocytes. A granulocyte. A stands for absence, right? So here the granules are not present, or you can say granules are not seen under the microscope. Like in monocyte, fine granules are there, but these fine dust-like granules can't be seen under the microscope. So you can say it as a agranulocyte. A stands for absence of granules, so called as agranulocyte. Now let us go through the count. Okay, neutrophils. Neutrophils are present in 50 to 70%. Out of the all white blood cells, neutrophils are present 50 to 70%. Eosinophils are present 1 to 4%. 1 to 4%. Basophils less than 1%. Hardly you can say any basophil you can see. Okay, less than 1%. Monocytes 2 to 8%. 2 to 8% are monocyte. And lymphocytes are 20 to 40%. So if we see the overall percentage of all WBCs, you can see that neutrophils are highest in adult. Neutrophils are highest, and second highest is lymphocyte, right? And the least one, that is basophil. Basophils are least, less than 1%. So that is the percentage of different white blood cells. Now let us go through the important aspect of white blood cell, that is leukopoiesis. Understand the word carefully. Leukopoiesis. Leuko stands for white, right? Poiesis stands for formation. It means formation of white blood cells, formation of mature white blood cells. On an average, it takes 12 days. In the bone marrow, it takes 12 days for the formation of mature white blood cells. From the stem cells, it will cause 12 days to form the granulocytes. Now, for the formation of the granulocytes and agranulocytes, there are different ways, right? So, let us go through the granulopoiesis first. Understand the word carefully. Granulopoiesis means formation of granulocytes. Formation of granulocytes. So it takes 12 days in bone marrow to form the mature granulocyte. Now, what are the various steps? What are the different steps for the formation of the granulocytes? You know this, right? In hemopoiesis, I already covered that in the stem cells, these stem cells are pluripotent, means they are capable to divide into any series and it can form the mature cell. If the stem cell diverts towards the erythroid series, then it will form mature erythrocyte. If it diverts to the WBC series, depend on the type of the cluster forming unit which is formed, it will form that cell. Okay, if it is for the basophil, then it will form mature basophil. If it is for neutrophil, it will form mature neutrophil. If it is for eosinophil, then it will form mature eosinophil. If it is for monocyte, then it will form monocyte. So this way depend on the which cluster forming unit is formed, that mature white blood cell will be formed. And stem cells will be diverted for the platelets, right? For the thrombocyte formation. So this is about the pluripotent stem cell. In hemopoiesis, I already covered this. Now we are talking about this. Leukopoiesis means formation of the white blood cells. For that, in granulopoiesis, for the formation of the mature granulocytes, the stem cells will undergo various changes. Okay, now this is totally dependent on which cluster forming unit which is formed. Okay, so it will divide. First it will form myeloblast. First it will form blast cell, that is myeloblast. Then it will form promyelocyte. It will form promyelocyte. Then myelocyte proper. Okay, first it from the stem cell it undergoes the change. Okay, and it will form myeloblast, blast cell. Okay, this is very big, around 18 to 20 micrometer in diameter. As the stage is advances, then the cell size will reduce. Cell size will reduce. Okay, so it will form promyelocyte, then it will form myelocyte proper, then it will form metamyelocyte, and then it will cause formation of mature WBC. Now depend on which series, which cluster forming unit is there. Okay, that mature WBC will be formed. Okay, whichever is the cluster forming unit. If it is for neutrophil, it will form mature neutrophil. If it is for basophil, it will form mature basophil. If it is for eosinophil, it will form mature eosinophil. Okay, so this way, depend on the cluster forming unit. For that, it will form that mature white blood cell. Granulocytes, when they are formed, it will be stored. Okay, rather than getting released directly, it will stay in the bone marrow till it is needed. So it will be stored in bone marrow. It will be stored in the bone marrow and it will be released in the circulation whenever its need will arise. Okay, so this is granulopoiesis. Leukopoiesis is having many different stages, not different stages but different types, you can say. Granulopoiesis, formation of monocyte is also a different way. Formation of mature lymphocyte is also occur in a different way. So right now we talked about granulopoiesis, means formation of the mature granulocyte. So these all are the series of changes. Once the mature granulocyte is formed, it is somewhere near 10 to 14 micrometer, or you can say 12 to 14 micrometer in diameter. Now come to the formation of the monocyte. How the monocyte will be formed? Okay, for those cluster forming units from the stem cells, those cluster forming units which are diverted to form monocyte, it will form first promonocyte. Okay, it will first form promonocytes. Here inside this, fine granules are present. Okay, fine granules are present in this. So promonocyte will form finally mature monocyte. Okay, now here once the monocyte is formed, it will be released into the circulation. Once it is formed in the bone marrow, it will be released into the circulation. Okay, now what will happen here? It will stay in the circulation for 48 to 72 hours, or you can say 2 to 3 days, right? After that, it will enter into the tissue. Monocyte from the circulation, it will enter into the tissue. Spleen and lymphoid tissues. Inside the tissue, once it enters into the tissue, it will enlarge. It will enlarge. It will increase in the cytoplasmic content of it. cytoplasmic content of the monocyte will increase in the size, increase in the cytoplasmic content, increase in the mitochondria. Okay, and it will get converted now into the macrophages. It will get converted into macrophages. These are called as tissue macrophages. So monocyte is important, the one which is causing the formation of monocyte macrophage system. It will cause the formation, or you can, previously it was known as reticuloendothelial system. Reticuloendothelial system. Now it is called as a monocyte macrophage system. Monocytes, once mature monocyte is formed in the bone marrow, it is released into the circulation. In the circulation, it will stay for 48 to 72 hours. Once it, then later on, it will enter into the tissue. Once it enters into the tissue, it will increase in the size, increase in the cytoplasmic content of it, and gets converted into macrophage. This is called as a tissue macrophage. Now here it can stay in the tissue. That is called as a fixed tissue macrophage. If it stays in the tissue, it is called as a fixed tissue macrophage. And if from the tissue it is released into the circulation, then it is called as a mobile macrophage. Okay, but monocyte plays important role. Here what we need to remember is it plays very important role in formation of tissue macrophage system. Now come to the lymphocyte. How the lymphocytes are formed. Lymphocytes, those stem cells which are diverted towards the formation of lymphocytes. Okay, some of them will migrate to thymus and some of them will stay in the bone marrow. Some of the lymphocytes will migrate into thymus and some of them will stay in the bone marrow, and they will proliferate there and it will be released at T cells. If it proliferates, migrates to the thymus, and there it will proliferate and it will be released as a T cells. If it stays in the bone marrow, then it will eventually form B cells. Okay, T lymphocytes and B lymphocytes. These mature lymphocyte, once the mature lymphocyte is released, it can be large lymphocyte or it can be small lymphocyte. Okay, large lymphocyte eventually forms the small lymphocyte. Okay, so this way the different white blood cells are formed. Okay, now we completed the discussion of granulocyte formation, monocyte formation, and lymphocyte formation. Okay, we are done with this much: granulopoiesis, monocytosis, the formation of the mature monocyte and mature lymphocytes. Now come to the regulation. How this formation of different white blood cells are regulated. Whenever there is a granulopenia, understand the word carefully, penia. Penia means decrease. Granulo means decrease in the granulocyte count. Okay, so granulopenia, or when there is a dead granulocytes, if there are dead granulocytes and monocytes, in that case what will happen? It will cause stimulation. It will cause a release of different colony stimulating factors. Now, what are these colony stimulating factors? Granulocyte colony stimulating factor, monocyte colony stimulating factor, granulocyte, monocyte colony stimulating factors, and different interleukins. Okay, so it will cause release of these colony stimulating factor. Now these, see, the word itself says stimulating factor. It means it will stimulate. It will stimulate bone marrow, okay, to increase the formation, of different granulocytes and monocytes. Okay, so this is how the regulation of leukopoiesis will occur. Whenever there is a granulopenia, means decrease in the granulocyte count, or there are dead granulocytes and monocytes. So when this will happen, it will cause release of various stimulating factor, colony stimulating factors, like granulocyte colony stimulating factor, monocyte colony stimulating factor, granulocyte monocyte stimulating factor, colony stimulating factor, interleukins. This all will cause a stimulation of the bone marrow, and this will cause increase in the formation of various granulocytes and monocytes in bone marrow. So that is how leukopoiesis is regulated. Now come to these different structure of these different white blood cell. See the structure of the neutrophil carefully. It is approximately 10 to 14 micrometer in diameter. Okay, 10 to 14 micrometer in diameter. See this one, it is a granulocyte. So here you will find fine granules. Fine granules will be there. See the nucleus. It contains multiple lobes. Okay, it ranges from 1 to 8 to 9 lobes, you can say. Okay, it is multi-lobed. Neutrophils are multi-lobed. Okay, and the fine granules which are present, okay, pinkish purple granules which are present, inside these granules there are various enzymes. Various enzymes are present in it. Now, what are these different enzymes? These enzymes are glycosidases, then sulfatases, then phosphatases, nucleases, and different proteolytic enzymes. Different proteolytic enzymes and lysosomes, myeloperoxidase. These are various enzymes which are present in the granules of the neutrophils. Glycosidases, sulfatases, phosphatases, nucleases, proteolytic enzymes, lysosomes, myeloperoxidases. These all are the enzymes which are present in the granules of the neutrophil. Now, what these granules or what these enzymes will do? It will function it is important to carry out various functions. Now, what are these functions? They plays important role in phagocytosis. It plays very important role in phagocytosis. Phagocytosis means engulfing the solid particles, right? So, it plays very important role in phagocytosis as it contains various endogenous pyrogens. It contains various endogenous pyrogens. So they plays very important role in febrile response. It plays very important role in febrile response. It also plays very important role in reaction to inflammation. Plays very important role in reaction to inflammation because it releases various leukotrienes, different prostaglandins, thromboxane. So these all are important. They play very important role in inflammation. They plays very important role in inflammation and brings various signs of the inflammation like vasodilatation and edema. like vasodilation and edema. So if we enlist the functions of the neutrophils, important functions are phagocytosis. Second important function, it contains endogenous pyrogens, so it plays very important role in febrile response, and plays important role in reaction to inflammation. It brings the responses like vasodilation and edema. Now come to the another granulocyte, that is eosinophil. Eosinophil is also 10 to 14 micrometer in diameter. Usually it is bilobed. It is bilobed, and the granules will contain histamine. It contains histamine, different lysosomal enzymes, eosinophil chemotactic factor of anaphylaxis. So these are the different contents of the granules of the eosinophil. You can see the pinkish granules, coarse granules are there, which are not covering the nucleus. Okay, so bilobed structure, usually it is in containing the coarse pinkish granules. The granules are containing histamine, lysosomal enzymes, and eosinophil chemotactic factor for anaphylaxis. Now what are the important content? Granules, apart from this, it also contains various lethal substances. Lethal substances like major basic protein, which is highly larvicidal. It also contains eosinophil cationic protein. Which is bactericidal, and it can destroy helminths. Okay, eosinophil cationic protein, major basic protein, eosinophil cationic protein, eosinophil peroxidase. It also contains the eosinophil peroxidase, which can destroy helminths, bacteria, tumor cells. So they are highly lethal. Okay, eosinophil granules, which contains these lethal substances like major basic protein, which is highly larvicidal, so plays important role in fighting against the parasites. Then eosinophil cationic protein, okay, bactericidal, it can destroy helminths. Then eosinophil peroxidase, it can also destroy helminths, and it can destroy the tumor cells, it can destroy bacteria. Then eosinophil derived neurotoxin. See the word neurotoxin. So that it is toxic to the neurons. Okay. So it can destroy the nerve fibers. Okay. So this is about the structure of the eosinophil. Now come to the function of the eosinophils. What are the important functions which can be carried by the eosinophil? It carries important function that is phagocytosis. It is having mild phagocytic function. Okay. Then another one is it gives local immunity. It plays important role in local immunity. Then it can attack, as I told you, that it contains various lethal substances specifically for the parasites, right? So it can attack the parasite. It can attack the parasites, and it can phagocytize it. Okay. In phagocytosis of it. It also plays very important role in allergic reaction. So what it will do here? They are capable of detoxifying inflammation inducing substances. It will inhibit the mast cells. It can inhibit the mast cells degranulation. Okay, so it can limits the inflammatory response, and it will phagocytize and destroy the antigen antibody complex. It can destroy the antigen antibody complex. So it will prevent the spread of the local inflammatory processes. So this way it is also having a important role in allergic reaction. Okay, they are capable for detoxifying the inflammatory inducing substances, inhibits the master cell degranulation. So it can phagocytize the antigen antibody complex, and thus it will limit the inflammation. So that is the important function of eosinophil. Now come to basophil. Basophils are also 10 to 14 micrometer in diameter. They are also bilobed. See, coarse granules are there. Blue colored, dark blue colored granules are there which are covering the nucleus. Okay, they are, you can say, overloading. They overload the nucleus. Thank you so much, Shri, for your feedback. Thank you. So basophils are 10 to 14 micrometer. Granules are coarse granules, blue colored, dark blue colored, and they are covering the nucleus. Thank you for your words. Shri, thank you for your words. So now let us see the granular content. What these granules will contain? These granules will contain histamine, heparin, 5-hydroxytryptamine, or you can say serotonin. Is both are same. Okay, 5-hydroxytryptamine or serotonin. So as these are the important content of the granules of the basophils. I am grateful that my students are really happy with this teaching. Thank you so much for your words. Shri, thank you so much. So, important functions of basophil is mild phagocytosis. Phagocytosis is also important in allergic manifestations. See, this is very, very important. Allergic manifestations, because it contains histamine, right? Histamine, 5-hydroxytryptamine. So it will release histamine, bradykinin, serotonin. So it will cause local vascular and tissue reaction. Okay, that will bring the various allergic manifestation. Okay, Shri. Thank you so much. Thank you for your words. I am really happy when students are really get help with these videos. Thank you so much. Allergic manifestations. So it brings the local vascular and tissue reactions. Okay, it releases histamine, bradykinin, 5-hydroxytryptamine. So this all will cause, it will bring the allergic manifestations. Okay, it will it will also prevent the spread of inflammation. It causes allergic manifestation. This is something very important. It is important for allergic manifestation. Same time, it prevents the spread of the allergic inflammatory responses too. By it releases the eosinophil chemotactic factor of anaphylaxis. So that will cause the eosinophils to migrate towards the tissue which is involved with these allergic reaction. Okay, and eosinophil, then it will phagocytize. Eosinophil will phagocytize. Okay, it will phagocytize and destroy the antigen antibody complex, and this way it will help to limit the spread of inflammation. Okay, so allergic manifestation, say it elicits the allergic manifestation, same time it limits the allergic manifestations also, because granules are containing the substances which are responsible for the allergic manifestations like histamine, bradykinin, 5-hydroxytryptamine, and same time it prevents the spread of the allergic inflammatory process also, because it releases the eosinophil chemotactic factor of anaphylaxis. So it will cause the eosinophils to migrate at the tissue which is involved in the process of inflammation or allergy. So ultimately eosinophil will destroy the antigen antibody complex and it will limit the process of inflammation. Then it will liberate heparin. Heparin is important anticoagulant. So it will prevent the clotting. Word itself says anticoagulant. So it prevents the clotting. Okay. And it also activates the lipoprotein lipase, basophil granules, which releases the way this heparin. It also activates the lipoprotein lipase, okay, which removes the fat particles from the blood after fatty meal. So that is also very important. Good evening, S Verma. Good evening. So these all are the functions, important functions of the basophil. Mild phagocytosis, it helps in allergic manifestations. Same time, it prevents the spreading of these allergic inflammatory process, and it liberates heparin, which is very important anticoagulant, the one which prevents the coagulation. Okay, now come to the next one, that is lymphocytes. See, as I told you, lymphocytes are two types, large lymphocyte and small lymphocyte. This I in detail I will cover in the class of immunity. Large lymphocyte is somewhere near 10 to 14 micrometer in diameter, and small lymphocyte is 8 to 10 micrometer in diameter. These are agranulocytes, right? So you can see the small rounded large nucleus which is covering majority of the part of the cytoplasm. In small lymphocyte, hardly a rim of cytoplasm you can see. Majority of the part is occupied by the nucleus. And in large lymphocyte, relatively you can see the good amount of the cytoplasm, but still the nucleus content is more. Okay, so an important function of the lymphocyte, it plays important role in immunity. Okay, it plays important role in immunity, that I will discuss separately. Okay, separate classes of immunity will be there. Okay, now come to the last one, last white blood cell, that is monocyte. This is very important MCQ, largest WBC present in the circulation. Okay, monocyte is largest WBC, 12 to 20 micrometer in diameter. See this one, almost triple of the size of the RBC. See the cytoplasm, large amount of cytoplasm, and you can see the indented nucleus, kidney shaped nucleus, which is usually in the acentric position. Okay, which is in the acentric position. Cytoplasm may contain fine dust-like granules that are called as azure granules, but you won't be able to see it under the microscope. Okay, so now come to the function of the monocyte. Important function of the monocyte is phagocytosis. Phagocytosis, as I told you, it forms the monocyte macrophage system. Monocytes, once they are formed in the bone marrow, they will be released into the circulation. In the circulation, it will stay for 48 to 72 hours, right? Then it will enter into the tissue. When it enters in the tissue, it increases the size, increases the cytoplasmic content, increases the granular content, and now it is called as a macrophage, that is the tissue macrophage. If it stays in the tissue, then we call it as a fixed tissue macrophage. And if it doesn't stay in the tissue and becomes freely moving in the circulation, then it is called as a mobile macrophage. So it plays important role in forming the monocyte macrophage system. They also synthesizes various biological substances. It synthesizes the complement and various biological substances. It can also kill. It can kill the tumor cells. It can kill the tumor cells. Once it is sensitized by lymphocytes, then it can kill the tumor cells. So these all are the important functions of the monocyte. Phagocytosis, it is plays important role in formation of the tissue macrophage system. Previously, it was known as a reticuloendothelial system. Okay, RE system or monocyte macrophage system, both are same. Reticuloendothelial system and monocyte macrophage system, both are same. Okay, then it also causes formation of various biological substances. It can kill the tumor cells once these tumor cells are sensitized after sensitization by lymphocytes. So this is about the functions of the monocyte. Now come to the normal value. Normal values of white blood cells. In case of children, total white blood cell count. Right now we are talking about total white blood cell count. It is 20,000, approximately 20,000 per microliter. And in adult, it ranges from 4,000 to 11,000 per microliter. Okay. See, I told you in the previous classes also that always remember RBCs are in millions, WBCs are in thousands, and platelets are in lakhs. Okay, so it will help you to avoid the confusion. Okay, so white blood cells are present in thousands. In children, it is around 20,000 per microliter. In adult, it ranges from 4,000 to 11,000 per microliter. So this is all about the formation and functional aspects related to the white blood cells. If you have any question, you can ask me. Okay, so in that case, you join me in open house session at 8:45. After 2 to 3 minutes, I will be there in the open house session. You can talk to me there. This is the audio room available on the app. You can interact. We can have a conversation. I can talk to you and solve your doubts. So you can join me in the open house session on the app. Okay. So study hard, study with us, study with me. Unacademy Future Doctors channel, subscribe this channel and help us to reach to more and more number of students. Thank you so much.